Hello, everyone, and welcome to our webinar on nutrition and exercise for pregnancy with type 1 diabetes. My name is Caitlin Parker. I'm a Credentialled Diabetes Educator, Accredited Practising Dietitian, and I live with type 1 diabetes. Today, we'll be covering a few different things. So we'll be talking about our general guidelines for nutrition in pregnancy. We'll talk about extra considerations for nutrition in pregnancy with diabetes. We'll talk about the guidelines for exercise in pregnancy and also using exercise as a diabetes management tool during pregnancy. So starting off with talking about nutrition, one of my favorite things to talk about. In terms of our current guidelines, the dietary recommendations for pregnant women versus non-pregnant women are almost the same. So we're still aiming for lots of food from the 5 food groups, minimal amounts of foods from the discretionary food, and water as our main drink. The only difference is that there are slightly more nutrient-dense foods recommended during pregnancy, especially in the 2nd and 3rd trimester. And generally, this is from more foods from the vegetables, protein, and grains group. You can find these dietary guidelines at eatforhealth.gov.au. It's got both the non-pregnant and pregnancy guidelines available there. So if we were to eat according to these dietary guidelines, what we would be looking at is something like this 3 times per day, plus 2 to 3 snacks containing about 2 serves of fruit and 2 serves of dairy, healthy fat, and whole grains. So our plate, we would want half of our plate to be salad or veggies. We would want 1/4 of our plate to be a protein containing food, 1/4 of our plate to be a grainy food, ideally whole grain, and we want to contain some of these healthy fats in small amounts. Our snacks could be something like whole grain crackers and cheese, so something like Vita Wheats are a good idea. We could do yogurt and fruit with nuts or seeds or both. And we could have something like a piece of fruit and a glass of milk or a milky coffee. We've got a couple of key nutrients that we talk about during pregnancy, and these are because we either want to make sure that we're getting enough of them or the amount recommended for pregnancy is slightly higher than for the general population. So the first one that we'll talk about is folate or folic acid. And this one is important for brain, spine, and nerve development. Most people living with diabetes during pregnancy are recommended to supplement with high dose folic acid. So general population is recommended to have 0.4 milligrams versus 5 milligrams, which is what is recommended for most people with diabetes during pregnancy. And we're encouraged to take this for 3 months prior to pregnancy, prior to conception, and up until 12 weeks gestation. This is due to an increased risk of neural tube defects in pregnant women with diabetes, so 0.57% versus 2.2%. They don't really know what causes this increased risk of neural tube defects, but it's likely due to the slightly higher blood glucose levels, even if you are adhering to those tight glucose targets, and potentially also folate deficiency. So by supplementing this high dose folate, they're trying to rule out folate deficiency as being a cause of this increased risk of neural tube defects. Dietary sources of folate and folic acid are whole grain bread and bread making flour that has been supplemented with folate, dark green leafy vegetables, legumes and lentils, oranges, strawberries, avocados and bananas, tofu and Vegemite. That being said, it's important that people living with diabetes who are pregnant supplement with that high dose folic acid supplement if recommended, regardless of these diet sources as well. Our next key nutrient is iron. So this one is really important for your baby's growth and red blood cell development. Is from 18 milligrams per day, not in pregnancy, to 27 milligrams per day during pregnancy, which is a really high target to try and aim for. Heme iron or meat-based iron sources are generally absorbed better than non-heme iron or plant-based iron sources. And having vitamin C with a non-heme or plant-based iron can help to improve our absorption. Caffeine, tea, and coffee can decrease our absorption. So if you're taking a calcium supplement or you're enjoying a cup of tea or coffee, make sure you have this separate from your iron supplement if you're taking it, or your iron rich sources of food. Generally, about half an hour to an hour separate is enough. Our dietary sources of iron include, so these are foods with 2 milligrams of iron or more per serve. So beef, lamb, sardines, salmon, lentils and legumes, baked beans, cashews, dried apricots and muesli, whole grains, as well as iron fortified products. So foods with iron that has been added to it, like Wheat Bix and Milo. Depending on what your iron levels are doing, your doctor might also recommend an iron supplement. Our next key nutrient for pregnancy is iodine. So this one is important for our brain development and our thyroid function. It's included in most pregnancy multivitamins, but you want to just double check and make sure that your supplement contains at least 150 micrograms of iodine. Our dietary sources of iodine are fish and seafood, iodized salt, seaweed, but it's not recommended that we have brown seaweed or kelp or seaweed supplements because sometimes they can be inconsistent with the amount of iodine that we have during pregnancy. Bread, eggs, and dairy. Talking about foods to avoid during pregnancy, we want to avoid alcohol. We want to reduce our caffeine intake potentially to less than 200 milligrams per day. So this could be something like one double shot coffee or 3 instant coffees or less. We want to avoid deli meats, so things like ham and salami, pate, soft cheeses, soft serve ice cream, raw and undercooked meat, smoked salmon, raw seafood, pre-cooked prawns and sushi, raw or undercooked or runny eggs. And we're aiming to avoid these due to our risk of Listeria and Salmonella. We also want to limit large fish, and we'll talk about this on the next slide. But this recommendation comes about because of mercury levels. So higher amounts of mercury can affect the brain and nervous system of the developing baby. So we are recommended to limit shark or flake or billfish to 150 grams served per fortnight and no other fish that fortnight. 150 grams is approximately the size of your hand. Orange roughy or catfish to 150 grams served per week and no other fish that week. And all other fish, 2 to 3 serves per week is fine. So these could be things like salmon or tuna. Moving on to talking about carbohydrate. So people with diabetes often have quite a complicated relationship with carbohydrates. So when our blood sugar levels are higher, or we're finding that we're becoming more resistant to insulin as we do during pregnancy, the automatic response is often to reduce the carbohydrate or control the carbohydrate that we're eating. But it's slightly different in pregnancy because we want to make sure that that baby is getting enough carbohydrate to grow and develop. It's very hard for them to study the best or I guess most appropriate amount of carbohydrate in pregnancy. But generally, most people agree that consuming around 175 grams of carbohydrate per day is a good amount to aim for. This amount is thought to be enough for our fetal brain development or the baby's brain development, and also to prevent ketosis in the mother. The quality is important. So what we're looking for is slow release or low GI carbs and also nutrient dense carbs. We also want to try and spread our carbohydrate throughout the day. So this 175 grams of carbs could be broken up to 30 to 45 grams for 3 meals a day, and then 15 to 25 grams of carbohydrate for 2 or 3 snacks. Or it could be something like breakfast, 20 to 30 grams when our insulin resistance tends to be higher. Lunch, 50 grams. dinner 50 grams, and then 15 grams for 3 snacks each. This first pattern could look something like this. So we could do something like porridge, which is a rolled oat, is a low GI carbohydrate made with milk and topped with something like berries. We could have a milky coffee and a handful of nuts mid-morning. We could do something like a protein and salad sandwich made on whole grain or grainy bread and a piece of fruit. All low GI options there. We could do a grainy cracker like Vita Wheat with cheese and then a high protein or lower sugar yogurt like YoPro. A mixed plate according to that plate model we talked about earlier, where we have half of our plate to be salad or veggies, 1/4 to be carb foods, and then 1/4 to be a protein containing food. And then finishing it up with something like a piece of fruit toast with some peanut butter before bed. When we talk about this food in relation to insulin, this is a picture of what the most common insulins look like. So most of our quick-acting insulins, so things like Novorapid, Humalog, Apidra, they start working in 10 to 15 minutes. They peak at 60 to 90 minutes, and they continue to last for about 4 to 5 hours. Fiasp is similar, but it is a little bit faster. If we then talk about low GI carbohydrates, where they are broken down and slowly released instead of causing a broken down quickly, like high GI and causing a spike. Examples of these low GI carbs could be things like lentils and legumes, most of our fruit, except for watermelon, rockmelon, and fruit that's canned in syrup, sweet potato or charisma, white potatoes, as opposed to many other types of white potato, grainy bread as opposed to white bread, and things like rolled oats. We are aiming to choose mostly low GI carbohydrates because these tend to match our insulin better. So as we said, they start to work in 10 to 15 minutes. They peak at 60 to 90 minutes and they keep working for 4 to 5 hours. So our low GI carbohydrates tend to peak at around an hour, I suppose, whereas our high GI carbs tend to peak at less than 30 minutes. They continue to work for a few hours, so probably more than 2, which is when our insulin is still working as well. We can do other things to reduce the GI of our meals. So if there are high GI carbohydrates that you prefer, there are things that you can combine them with to try and reduce the carbohydrate. So we can add fat and or protein. We can add acidity. We can add fiber, and we can cook and then cool things like rice and potato. So the example is a white bagel, which is a typically high GI food. If we combine that with peanut butter, which contains fat and protein, and also something like a banana, which contains that fiber, that will help to dull the spike that that usual high GI carbohydrate would cause. So talking about all this stuff to do with food and nutrients, who can help me? So dietitian is your the one to talk to about all things to do with food and nutrients. Your obstetrician or your obstetric physician, so your baby's doctor or your doctor, can help you in terms of whether or not you need to supplement things like iron. And your pharmacist is a great one to talk to about all different types of supplements, multivitamins, and that kind of thing. Moving on to talking about exercise. So this, to start off with, we've got our exercise guidelines for the general population. So we are recommended to include some activity every day, and we're aiming to do at least 2.5 to 5 hours of moderate intensity exercise each week, or 1.25 to 2.5 hours of vigorous intensity exercise each week, or a combination of both. We're encouraged to include muscle strengthening activities twice per week. and some is better than none. So if you can't meet these recommendations perfectly, it doesn't mean there's no point. We still want to work towards being more active. So if you haven't been active in a while, starting small and then building up can be a good thing to do. Include small amounts of activity in your day. So park your car further away, take the stairs, all of that kind of stuff, and also spend less time sitting. The exercise guidelines for pregnancy are the same, except they also recommend adding pelvic floor exercises, modify exercises as required throughout pregnancy, and avoid anything with risk of falling or collisions or heavy lifting and sudden changes in pressure. We want to follow medical advice if we have any complications with our pregnancy too. Build up slowly. So now is not the time to start something new, but it is a great idea to continue what you were doing if it is safe throughout your pregnancy. There are so many benefits to exercising during pregnancy, and these are things like preparing for our labor and delivery, which is very physically demanding. It can help with our mental health and it can lower risk of postnatal depression. It can help with our back pain and pelvic pain, and it lowers our risk of incontinence. Another perk is that because it increases or decreases our insulin resistance, it also decreases the risk of gestational diabetes for general population because it just helps that insulin pathway to work a little bit better. Exercise is medicine, and this is also true during pregnancy. So we can use exercise to help us manage our blood sugar levels. By building more muscle, it gives us more space to store glucose. And because of this, we have more of a buffer and better blood glucose management. And exercise also helps to open the back door to our cell, which can then help our body use the glucose that is in our blood and lower our blood glucose levels. So speaking a little bit more about that, so the way that insulin works is that insulin will bind to these receptors on the surface of the cell, and this will cause these GLUT4 glucose transporters to move to the surface of the cell and let the glucose into the cell so that we can use that glucose as energy. Exercise also stimulates that movement of those GLUT4 transporters, but it doesn't require insulin. So it kind of is like opening the back door to the cell. We can get that glucose into the cell without needing insulin to make that happen, particularly during periods where we're more insulin resistant than usual. It also helps to enlarge our blood vessels around our muscle, which can then allow more glucose to get to that muscle and potentially be used as fuel and taken out of our blood. Different types of exercise will impact blood glucose levels differently, and it's a great time before pregnancy to test how these exercises affect your blood sugar level so that you can practice, I guess, managing them. So this picture gives you a bit of an idea, but our anaerobic activity, so things like sprinting or lifting heavy weights, can cause our blood glucose levels to go up. Aerobic exercise like cycling or running can help to go our blood sugar levels go down or tend to cause us to go low. So as we said, exercise is medicine. So that aerobic exercise can help to manage post-meal blood glucose spikes during pregnancy. So aerobic exercise is any activity that uses large muscle groups and can be maintained continuously and is rhythmic in nature. So this is things like walking, swimming, cycling, running. If you are having trouble with high blood glucose levels, especially after food, try including something like a 10-minute walk or similar after the meal, and this can help your body to use up that glucose and help with that postprandial or post-meal spike. Exercise can also increase insulin sensitivity for up to about 24 hours after it's done. So including some kind of exercise daily can help with that ongoing insulin sensitivity or decreasing that resistance. The other thing that we want to keep in mind is the impact of anaerobic exercise on blood sugar levels. So these exercises tend to be short and have high intensity, and it can be things like strength training or lifting heavy weights. and HIIT training, so high intensity. These can cause a blood glucose spike due to the stress hormones that are released, and you might need to give a little bit of insulin to help you to manage this spike. Despite this, um, increase in blood sugar levels while you're doing it or just after you've done it, it can still increase that insulin sensitivity for the following 24 hours. So provided that you are managing your blood glucose levels during the session, it can still provide benefit for the rest of the day, just like aerobic exercise. Talking about low blood sugars and exercise, even though we have this insulin resistance happening during pregnancy, exercise itself can still make our blood sugar levels go too low, even if we are high before we start or higher before we start. So we still want to make sure that we're carrying hypo treatments. If we've got more active insulin working, so if it's just after a meal, we're at more of an increased risk of going low. So timing is important. Doing something like walking after a meal, if your blood sugar level is high or you're tending to spike after a meal, can help to bring it down. But if you're finding that you're going low too much, you may find that separating it from meals can help because you've got less active insulin working. It's still not recommended to exercise if you have ketones or if your blood sugar level is more than 15, just as we recommend with the general population too, or the non-pregnant type 1 diabetes. In terms of exercise, who can help me? So physiotherapists are great ones for things like pelvic pain, um, pelvic floor, and also planning exercise. Your obstetrician or obstetric physician will be in charge of things like complication screenings and making recommendations of what you may or may not be able to do. Your diabetes educator will help you with things like insulin adjustments, and your exercise physiologist can help you work out what to do and how to continue exercising safely. These are the references that we have referred to for this presentation. Thank you so much for listening. If you've got any questions, please send them through and we'll be happy to answer any of those.